So today we're talking about how TMS therapy works. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
Doc, can you tell me a little bit about how TMS actually works?
Yes, so TMS therapy is really a microcurrent therapy. We're giving a small magnetic field which gets through the bone into the cortex of the brain and creates a current which can adjust the frequency of the brain in that region. So you're causing a microstimulation in the region of interest where the magnetic field is placed. And over a daily process of doing this, we can tighten up the waveforms in those locations, take out some noise in the system, and in a sense tune the brain. And we'd like to treat more than one location, 5 different locations ideally, and this takes about 20 minutes to do each day.
When you say noise in the brain, what do you mean?
So think of your brain like a radio. It has either static or it's clear. There's signals that we're trying to amplify. So the signal that you want, we want to amplify that signal, that calm go-to place that people go to when they're at rest, that meditative state. We actually amplify that signal.
Okay.
When you do that, you take neurons that aren't at that signal and you bring them on board. And the analogy I use is like a marching band. So you've got a marching band on the middle of the field. In cadence is the idea. That's music. That's an orchestra.
Mm-hmm.
If they get out of order, you first see noise. If you see them walk off to the sidelines, you get more noise.
Okay.
So we do all kinds of things to create noise. And our goal is to reduce the noise and to increase signal. So the best way, we think, to maximize the effect is to personalize the dose. In all medicine, we personalize dose. We give enough dose until we get a response.
Right.
And there's a thing called a dose response curve. You keep giving dose until you no longer get response.
Okay.
If you're not getting the appropriate response, you change your dose or you change your method. And so in PRTMS, personalizing our TMS, we're doing just that. We're changing and adjusting dose, which includes location, number of treatments, amplitude, and so forth, to try and get a better response. And we're using the patient's own response to the brain stimulation by a weekly EEG, electroencephalogram. And it tells us physically, is the brain changing? And then we ask the patient subjectively, tell us, are you better? Are we seeing improvement with anxiety or depression? And we monitor those scores. Both those sets of information go back into the computer and drive a solution for the next protocol. Did the patient respond subjectively, and are they responding objectively by the waveforms?
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.